Hi guys, in this video we're going to talk about estrogen, your mood, and menopause, and a lot of other things connected to the menstrual cycle. Okay, now here's the problem. A lot of the symptoms for high estrogen or estrogen dominance are very similar to low estrogen. So when you do research in the area of estrogen, you're going to find a tremendous amount of unknowns, complexities, and confusions. So as we go through this, I'm going to point out the things that we definitely know for sure, and then I'll show you what I'm going to recommend. So when people talk about estrogen, there's not just one estrogen. There's actually 3 different types of estrogen, and they all have slightly different purposes. You have estradiol, estriol, and estrone. Okay? When you're pregnant, you're primarily using estriol, which is anti-inflammatory, it is anti-cancer, and it has a lot of other properties. But when you're in menopause, you're primarily using estrone, okay? And this is the one that it increases your risk for certain types of cancer. But typically, when you're not pregnant and when you're menopause, the primary estrogen would be estradiol, but you also are producing these as well. So realize that your adrenal glands also make the 3 estrogens as well, and when you go through menopause, they do help to supply the lack of estrogens that the ovaries make. And so if you're going into menopause and the adrenal glands are weak, then you could start seeing all sorts of symptoms because the adrenals cannot back up these ovaries. So therefore you're going to end up with low levels of certain hormones and high levels of other hormones, and this can create night sweats, hot flashes, bone loss, and a whole series of other events. We do know in certain studies that when you're depressed, you do have a lower amount of estrogen. But this can occur at the first part of menstruation. It can also occur at other points during the cycle of hormones in a given month. It can also occur during menopause. So there's certain times where estrogen goes down. And then also, to make things more complex, you can have progesterone dropping out too far, giving this relative higher level of estrogen. Even though estrogen goes down, the ratios are going to be off, making it appear that estrogen is too high when it's too low. And you can also get depression and anxiety if the estrogen is too high. There's a certain structure in your brain called the amygdala. And the amygdala is the part of the brain that has the most estrogen receptors. And that little gland is responsible for all sorts of things related to stress. It can affect your mood and put you in a state of anxiety and worry and doom and gloom. So estrogen has a huge effect over your mood and your cognitive state. So when someone takes birth control pills, which is mainly synthetic estradiol, it's basically convincing the hypothalamus, kind of like the master gland in your brain, that you're pregnant and you don't need to ovulate, okay? So with that comes a lot of other complications, increased risk for blood clots, stroke, headaches, and the list goes on and on. If you compound that by consuming a lot of foods that are not organic, and smoking, and going through stress, you can really set yourself up for a lot of problems, not to mention gallstones and gallbladder disease. Now, if you're female, the most important thing that you can do to help balance estrogen would be to avoid commercial foods that contain hormones. And I'm talking about dairy. That's at the top of the list. Like milk, commercial milk. Not good because the amount of hormones in that milk is pretty high. Now the next worst thing would be commercial meat. So you want to make sure that your meats and your dairy and even your vegetables are mainly organic, okay? And also consume a good amount of cruciferous vegetables to clean these endocrine disruptors or estrogen mimickers and other hormones out of the liver and out of the body. Now your liver makes certain enzymes to help you balance estrogen. So if there's too much, your liver will detoxify that excess. The same thing with your gut. The gut has a very important purpose in making sure that there's not too much estrogen in the body. So if you have a fatty liver, okay, if you have liver damage, if you have a problem with your digestive system where you don't have enough good bacteria and too much of the unfriendly bacteria, this is where you can have a problem with an overload of estrogen in the system, and that can link to a whole bunch of other problems, including suppression of the thyroid gland. So high levels of estrogen can inhibit the thyroid function. And then when the thyroid is low, as in hypothyroidism, that can also affect your liver's ability to get rid of estrogen, your metabolism. All right, so that being said, there's a couple things that you need to focus on. Number one, go organic as much as possible. Of course, do keto and intermittent fasting, because that way you can reduce the sugar effect and the insulin effect, and just make sure it's high quality and make sure you do organic. Lots of cruciferous vegetables. Now, avoid dairy if you have problems with your menstrual cycle or you have too much estrogen. However, for most people, if they do grass-fed dairy, it's going to be okay. But I would definitely not recommend the milk or yogurt. Now, of all the nutrients, iodine is very, very important in regulating estrogen. It helps to balance estrogen by lowering the bad and increasing the good. You can get that in sea kelp or seafood, okay? The other mineral that's very important in menopause is boron. Boron is really essential to help balance estrogen, and it's really good for women that are going through menopause. And I would recommend it if you are experiencing irritability or depression. Take some boron, and I think you'll actually feel a lot better, because that's kind of like the missing element. So the combination of iodine and boron is very, very important. And then again, the cruciferous, the kale, the broccoli, the Brussels sprouts. There is a product that I use called Estrogen Balance that you might want to look at. It has something called DIM, which is a concentrated cruciferous. So one pill is equivalent to 2 pounds of cruciferous. So in this product, they put a lot of factors to help balance estrogen, whether it's too high or too low. So I hope this video wasn't too confusing, because there's so many complexities when you deal with the endocrine system, especially with estrogen, and so many unknowns. But I do know going organic is going to be very, very essential to protecting yourself in the future against the harmful effects of estrogen. Thanks for watching. Hey, you know what? I just wanted to say thank you for watching these videos. You made it this far. I appreciate your attention and your precious time.